Just before the break, we told you about 6 organizations across Asia joining hands to fight dengue. There's a new framework to speed up the adoption of prevention strategies. And for more, here's Professor Tikki Pangestu, who is advisor of the Asia Dengue Voice and Action Group. Professor, welcome to the show. Now, let's start with the current dengue risk, both in Singapore and the rest of the region. Are we in a better or worse position than before, and why?
Well, I would think that Singapore is in a good position within the region. Okay, in 2025, you had 4,000 cases, which is 70% less than what it was in 2024. That's very impressive. And why did this happen? I think the government has implemented some very effective measures to control mosquitoes, for example, through the Project Wolbachia. They've always been very strong in terms of surveillance and keeping track of dengue hotspots and taking immediate steps to, let's say, do the necessary to reduce the mosquito population. So Singapore is in a very good position. At the same time, there's no reason for complacency because at the time that the El Nino is becoming more prominent, in the coming months, coming 12 months perhaps, there will be higher temperatures because of El Nino. There will be increased urbanization projects. I mean, I go around Singapore, I see a lot of construction going on, MRT stations, huge HDB developments around Keppel Harbour, for example. Travel has sort of gone back even beyond pre-COVID levels. I come from Indonesia, and I know there's about 25 flights a day to Jakarta. Okay, and these are countries which have a lot of dengue. Okay, so I think Singapore is always held up as a poster child for dengue control, gold standard, very good. But once again, with what's coming, continued vigilance is necessary.
Yeah, and to make sure there isn't complacency and also to build on the current momentum. We have our authorities that are calling for a shift from just controlling outbreaks to then aiming now for zero preventable dengue deaths. How realistic do you think this goal is?
Okay, I'm going to answer that in 2 parts. I would say for Singapore, the goal of zero dengue deaths is reachable. And why do I say that? Firstly, the large majority of dengue deaths in Singapore happen in elderly people, those above 65 years of age. So it's a well-known high-risk group. So in the future, you could carefully keep track of the elderly and perhaps understand that they are more at risk. Because people above 65, like me, we tend to have comorbidities, which means that we also have other diseases, which puts us at higher risk if we get dengue. And as we get older, our immune system also becomes less effective in resisting disease. It's called immunosenescence. So when we get infected with dengue, unlike the younger people, we are unlikely to be able to fight it successfully, and we end up in hospital and probably die from it. So, what do you need to do? Unfortunately, vaccination against dengue with a newly developed vaccine is not yet authorized in Singapore, but would be one way to achieve that goal within Singapore is to vaccinate that particular group of elderly people. So that's for Singapore, reachable. For the rest of the world, I would say that's just a pipe dream.
Yeah.
Okay, Singapore is a unique case. You're a small island with very strong healthcare system, very strong surveillance, very good vector control. I come from Indonesia. We have 17,000 islands.
Yeah.
Okay, a healthcare system which is nowhere near as robust as yours. Yeah. We are so spread out that even our surveillance systems cannot keep track of outbreaks.
Yeah, despite those differences, I would say, it's also an opportunity for collaboration in that
Absolutely.
sense. And we have a regional MOU that was signed today to strengthen that collaboration. So what would success look like in practical terms for these countries?
Yes, that regional MOU, which was witnessed by Minister of State General Putucherry today, is a step in the right direction. And what would it do, okay, in terms of what we were talking about? First, it would enable the sharing of knowledge, data, and information amongst all the countries in this part of the world. Secondly, these organizations, which are advocacy groups, community organizations, NGO, will help with strengthening education and training. And importantly, the third dimension is to build stronger engagement with communities. Because dengue is not just dengue control is not just about the government doing all these things. Communities are so central to all of this.
Everyone has a part to play.
Everybody has a part to play. And getting community organizations involved will complement the government efforts because people buy into it. And Singapore has very good community engagement, the so-called block strategy, the dengue warriors. So the people in the community are part of the effort to control dengue. It's not just the government. So this regional MOU with many countries in the region involved is a very promising step in the right direction.
Professor, thank you so much for sharing those insights
Wonderful.
with us. I've been speaking with Professor Tikki Pangestu from the Asia Dengue Voice and Action Group and also the NUS Yonglulin School of Medicine.